Hospital of Zurich in the neuropsychology, where I saw lots of different patients, and I was really intrigued by patients with disorders of the perception of their body and their self. And I really think this kind of made me want to move into science and try to explore this in more detail, or find out what happened, because seeing these patients who would not recognize their own body anymore was very impressive for me. I then moved to EPFL in Lausanne and did my PhD in cognitive neuroscience, working on multisensory mechanisms underlying the bodily self. So we did, together with Jane, who's also here, we did many interesting experiments where we tried to manipulate how healthy participants mainly perceive their body or their self, and then study underlying mechanisms. I then moved for the first postdoc to Sapienza University in Rome, where I worked together with Professor Aliotti. There I had different projects. I started to get interested also in interoception, so in the perception of the body from like internal cues, like for example, cardiac signals. And I worked a lot with spinal cord injury patients, trying to see how such extreme change in peripheral sensory motor changes change their perception again of the body and the self. And then I moved for the second postdoc to Bern, where I did a project on risk for psychosis and schizophrenic patients, with the same idea, trying to see how the basic perception of their body and their self is altered in schizophrenic patients or risk for psychosis. I then moved on, I mean, not on actually, but back to the University Hospital of Zurich, where I had my first own little group, and we looked mainly at vestibular processes and how the sense of the body and the self can be disturbed or altered using vestibular stimulation techniques. I also worked in stroke patients there. And then I moved like 3 years ago to the University of Zurich, back to the University of Zurich, with this professorship for cognitive neuropsychology with a focus of body, self, and plasticity. And we are doing many different projects, but they're all kind of concerned with how people perceive their body and how this might influence different cognitive, emotional aspects, and so on. And we're working also in a lifespan approach, so testing infants from like 6-month-old children up to all elderly, not old people, but elderly. So this is what my lab is doing. But today I thought I would present something which is a bit special, maybe somehow, and it's one topic that I'm interested in, but yeah, please I mean, bear with me if it's not yet like kind of the perfect theory, because it's really something that we're thinking of. I will also present quite a lot of results that haven't been published, and I'm very happy to hear your feedback and your questions about it. So just a brief kind of plan for this talk. I would first give an introduction, and then very briefly, and again, if you're more interested in that, I'm happy to then like elaborate on it later on these different aspects. But I will get into how people get in touch with their body, so the more the developmental aspects. Then I would move to just being in touch with the body. So how do we generally perceive our body and ourselves? And then I would like to talk about 2 different ways that people lose kind of touch to their body. So this sense of disownership. In both the clinical context, and there I would like to talk mainly about this BID, body integrity dysphoria. I don't know how many people of you have heard about this disorder yet, but I will explain it to you. And then talk a little bit about how we try to mimic some aspects of this sense of disembodiment in healthy participants in the lab. And then give you some sort of conclusion and outlook as well. So if you first just take like one moment and focus on your body, you will probably have no issue or no problem to perceive your body from a first-person perspective, and also the world you perceive from the first-person perspective, and yourself as a sort of spatio-temporal embodied agent in this world. And while this is generally not very much or like very in the front of our consciousness, if I ask you to do it, I guess it should be quite easy for you. We perceive, so this sense of an embodied self has various subcomponents. For example, this first-person perspective, so we see, but also we hear from the point of view of our physical body. There's also other aspects like this body schema, body image. I will not go into the debate on body schema or image, but we perceive the body, we can tell more or less how it looks like, we know in which position the body parts are, and so on. We also have the sense of agency, which means that we feel like being in control of our own body. And what I will be talking about mainly now in the next few minutes is about the sense of ownership or body ownership. So this the feeling that the own body belongs to ourselves. And all of these aspects, of course, also relate to the fact, to this self-other distinction. So knowing what the self is and where your body is also kind of requires to know where like what the environment is or someone else's body. And if you think about that a bit more, and this is actually a slide that was inspired by my now postdoc, Malte Roel, and I think it's a nice way to introduce the topic. If you have to give a definition of, like an objective definition of what the body is, or where does your body end, and what is part of the body or not, this is quite tricky. Because if you think about implants, for example, would that be your body or would it not be your body? Or prosthetics, would that be part of the body or not? If you think about just something like hair, is the hair still part of the body or not? And or if you think about even in a more genetic way, that you think like everything that has my DNA is my body, but even that we know more and more that you have some cells with different DNA, for example, the mothers of their kids. So it's very hard to come up somehow with one like an easy definition, and I would be curious also to hear about it maybe in the later discussion, whether you have some nice idea there. But what I would like to talk about today is more about the subjective body boundaries and the subjective perception of the body. And for this, I really like to present this short illusion of a colleague of us doing the PhD, also with Jane, Sebastian Diegues, who described this illusion that I would, if we were now in person there, I would want you to try it. I guess most of you do not have a person next to you, so I will just briefly explain it to you, but please try it out later on with a glass of wine or like. So the idea is that two people put together their hands, and I put here the video of this robot. I guess you don't have a robot at home either, but you can just see how it works quite well here. So the people put their hands together and then someone has to stroke over the two index fingers. And that's basically it. And then you just have to see how it feels. And what people report in this situation is that it feels like numb, for example, but not on their hand, but on the other person's hand. So that already shows somehow a confusion of self-other boundaries. And just with these very, very simple methods of just synchronously stroking over the two index fingers. So how do we learn about our body? And of course, it's a huge field, and I will not be able to cover it in detail. However, a very important cue is synchrony, so that synchrony detection is the key in linking kind of the stimulations across the senses, and it's therefore a foundation for distinguishing between self and other objects, and also self and other events in the world. So I think this is very crucial. And if you look at babies, for example, really newborns, it has been shown that reflexes, for example, the reflex that if something touches the cheek, that they would turn the head, that there's a difference between whether this is an externally generated touch, so then they do more often turn their head, as compared to if they, for example, by chance touch themselves. So this randomly moving already in the womb kind of helps to detect the synchronies and to detect regularities, and from that to see to see whether it's your body or not. And of course, there has been quite a lot of research on that as well, that babies or infants quite early on are able to differentiate between synchronous versus asynchronous multisensory stimulation. So here, for example, in this paper, they did visual tactile stimulation. So, the infants would see a doll that is touched either synchronously with their own leg or asynchronously with their own leg, and you can tell that they have different looking preference or looking times. And very similarly, this is the case for visual motor synchrony. For example, this is like infants looking at the screen and seeing either the legs synchronously or asynchronously moving. And again, you can tell that they, from the reaction and from the looking time, that they make a difference. Very similarly as well for audio motor synchrony. So here the baby is sucking like a pacifier, and then the audio would either match or not match their motor movements. And again, you can tell that it makes a difference. More recently, and what we've also started in the lab, people have been interested also in the synchrony between visual and cardiac information, or visual and internal information. And I think Jane, who's here, she's like one of the first who, or the first who developed this paradigm. And it has been suggested that even babies already did again make a difference between a stimuli that is presented in synchronous with their own heartbeat as compared to asynchronous with their heartbeat. So that again suggests that they are able to even integrate, detect synchrony and integrate internal and external cues. So what you see here, this is actually the paper where they found this difference, and what you see here is from our lab. So this would just be an object flashing and synchronously, one that flashes async. I don't know if you can see the flashes. Yeah, and then we measured both looking preference time, but also grasping movement. So to see whether they would prefer the object more that was blinking in synchronous with their own heart, for example. We can talk about the results as well. They're actually not that promising, unfortunately, but we're still working on that as well. Then just what I wanted to say as well is that while this drive to detect synchrony is present very early on, the actual integration and the weighting of these different signals changes through development. And again, there have been many interesting studies by Dorothy Cowie and also together with Jane Aspel on how this weighting changes in development. And we have done, this is just one study now from our lab, where we have looked at in virtual reality children in avatars, and what we manipulated again was the different synchronous level when they were moving. So when they could either see the avatar moving in synchrony or with different delays, and we looked how this affected different aspects of body ownership or agency. And for example, what we could show here is that body ownership children, I mean, generally they're much more spread, which I guess is just the case in children, that they're kind of more variance in it. But other than that, they showed already a very similar pattern to adults, which was actually not the case for the sense of agency, for example. So there they were much less modulated by the synchrony. But yeah, this is just to show that this is a constant kind of adaptation between this synchronous, or between the weighting of this synchronous or asynchronous signals. So generally it's thought that the sense of our body is very plastic somehow, and that it's constantly constructed by the brain based on both bottom-up sensory input or sensory motor states, which again, this could be interoceptive cues, exteroceptive cues, all sort of vestibular proprioceptive cues and so on. But then also some top-down prior knowledge about how our body should behave or should look like and so on. And I think someone who really described that super nicely is Stratton in 1899. And I really recommend reading this paper because it's beautifully written as well. And I think it's quite surprising that he already came up kind of with the very same conclusion that we still think about today. So what he did is that he had this setup with 3 mirrors that allowed him to kind of project his own body into the front. And then he was wearing this device for 3 days. And he describes how this changes his perception in the body and in the self. And just to take 2 quotes out of it. So first he says, like, if we were always to see our bodies 100 yards away, we would probably also feel them there. All that is necessary is perfect uniformity. So again, and actually the paper is called The Harmony of Touch and Sight. So this synchronous information of different channels or sensory input drives the perception of the body. But at the same time, he also says in the paper, the harmony is found to consist in having our experiences meet our expectations. So there is this kind of top-down effect already described there of expectations. So this drive of the brain to integrate synchronous information, even if they might not be kind of, if they don't convey the same information, is really what has been used in these studies on body ownership a lot. So this is the most famous paradigm. I'm very sure that you've all seen this video already. I will just repeat without sound, ideally. I will repeat it again. So the idea is that the experimenter strokes the 2 hands at the same time. It's too much sound still. And yeah, and then this synchronous stroking of the rubber hand and the hidden own hand leads to the feeling that the rubber hand is his own. And then in that case, if the rubber hand is flattened, the participant would retract the hand as if it was her or his own hand. So this has really been widely studied and used in many experiments. But I think what's also interesting is that it has been developed further and further over the last years, and yeah, suggesting that you can extend body ownership. So in that case, like in the rubber hand, people would extend their body ownership to this rubber hand. And it has also been shown, for example, that you can extend it to 2 different rubber hands or several rubber hands, or also that you can extend it somehow to a different body. And I think that's something very interesting. This is just one example again from our lab, where people in the lab female embody a male or a female person, and this is now computer generated virtual reality. And then while they are in this body, they can, for example, do some cognitive tasks or whatever. This is really quite flexible. So there have been many different illusions described or ways to modulate kind of ownership. This is an example where they had a video on a robot, and the robot would follow the movement of the participants. So the participant can see the world and the body from the first-person perspective of this robot, which gives the impression that they have this robot body. So what I introduced in the very beginning, like this first-person perspective and so on, it's all centered on the robot. And please really interrupt me if things are not clear. So there's also, for example, another setup which is a bit similar one to the robot, where here the idea is that, and this has been developed by another lab, like an art science group, where they have here a robot that mimics the movements of the participant here. So if the participant moves the head, this robot would also move, and this robot has a camera on. So what that does is that it allows you to get a first-person perspective onto the other person's body. So, and you can naturally freely move and explore this other body. So this way, again, you can, it's quite interesting also to do, for example, social studies where you see how they're swapping with someone else or taking the perspective, not only really like literally taking the perspective of someone else can change cognition. And we've also explored that, the plasticity of that. For example, here we did one study where participant had the first person perspective on a grapefruit. And then we squeezed it in synchrony with their own body, and like they could smell also the grapefruit, and people really kind of immersed into being this grapefruit. So again, also for time reasons, I mean, if you're interested in, I'm happy to also elaborate on these studies. But this is just to show that this, like, extending body ownership to something else seems to be really quite flexible, and you can easily induce it with these different paradigms. And yeah, I kind of mentioned that already before, but I think it's this whole branch of research is very interesting for various reasons. Like you can look how, you know, like embodying someone else can change physiology, for example, or can change more cognitive aspects. And these are really just a few papers chosen, but of course there are many, many more. And there's really a huge literature on that. But also, for example, neurocorrelates of altered ownership, or for example, like this response to threat as well. So the studies that I showed, they typically use healthy participants, and they induce for a brief time this illusion of being someone else, or owning a different body part, or owning several body parts. But then if we go to more the clinical aspects, the question is, do we find similar disorders or experiences in the clinical sample? And there are, of course. I mean, there's people, for example, who feel like a supernumerary limp. So they might feel, typically after a right hemispheric brain damage, they might feel like they have an extra limp. Or also some cases of somatoparaphrenia, they report exactly kind of what the rubber hand illusion is. So they report as soon as you put a rubber hand or another person's hand in front of them, they would feel like this hand is their own hand. So that does exist in clinical population, in neurological population. However, what is kind of more common is rather the sense of disownership for the own body. And I think this is kind of what I would like to try to do in this talk, to say that it's not exactly the same, like having the sense of ownership for an external body part and losing kind of the sense of ownership for your own body, which is more common in healthy participants. And this, for example, is results from the group of Fotopoulou, where they looked at clinical cases with disturbed body ownership. And they also looked at clinical patients who have this extra condition that they would feel like a rubber hand in front of them would immediately feel like their own. And they could show in this voxel-based lesion symptom mapping study that this kind of differentiates also in terms of neural correlates, which I think is quite interesting. So if we go just for a brief moment back to the healthy participants, you could think of, like, if you experience this rubber hand illusion, what happens to your real hand? Would you feel like your real hand is disowned? Do you feel like two hands? And someone who has quite early looked at that is Matt Longo, who used this principal component analysis in the rubber hand illusion in order to see a bit more in detail what is actually what do they experience during the rubber hand illusion. And what you can see here is that this is the embodiment of the rubber hand. So in the synchronous condition as compared to the asynchronous condition, they more strongly embody the rubber hand, which is really this very well-known finding. But then if you look at the loss of own hand, which would be this disembodiment or disownership of the own hand, it's basically not modified by the rubber hand. So it seems rather that this is not affected by this illusion. And I mean, this is a paper from 2011, and I think there have been many more studies since then, but still I think this is still the case that ownership and like kind of the relationship between ownership, like altered body ownership for an external body part, and disownership is rather unclear. And this is where we wanted to look at a bit more in detail. So if you look at conditions, clinical conditions where people, there's many different ones where people report kind of losing touch to their own body or disembody or their own body. The most commonly referred to, at least in this study of the rubber hand illusion, is somatoparaphrenia, which is the sense, the feeling of disownership for one's own body. And I just brought you here one video, which is Swiss German. So I thought you can train a little bit to not fall asleep, but I think you actually don't have to understand in order to understand what she's communicating. So this is a patient with somatoparaphrenia, but also misoplegia. So she has this emotional affected response to her body part. Okay, so this part I think is no longer that interesting, but I guess you could see that she really has kind of this hate towards this body part that does not feel like her own. So yeah, I think this is very different from feeling like someone else's hand or body part belongs to you. This really is this body part that is attached to you, but that does not feel like you. And there's of course also other disorders involving this ownership of the own body in a more general way, like for example, depersonalization disorder. So there people often say, like, I mean, here is, for example, the mean, they have very high scores in feeling that their own body does not seem to belong to them anymore. But today I would like to talk about one specific condition that we did quite a lot of research on, and we're still doing research on, which is the body integrity dysphoria. And I would be curious to hear how many of you heard about it, but I cannot launch, I think, now. Yeah, so we can talk about it later on. But the principle is that these people feel like that part of the body does not belong to them. So these are two quotes of individuals with BID. One is, I can feel exactly the line where my leg should end and my stump should begin. The second one, the soul feels as though it belongs to a body with only one leg. The body does not correspond to this inner reality. So you can see that there's this mismatch between the physical body and the perception of their body. And it's really like this strong feeling that a part of it does not belong to them. And actually often, very often, that results in the desire for amputation of the affected limb. And you can imagine that this has quite strong ethical implications and social implications. And it's so far really hard to find therapeutic tools as well for these individuals. So here, just to show from one study that we did quite a long time ago with 8 left and 2 right BID with left or right amputation desire. And just to show you that on a scale from 0 to 6, for example, so they say the sense of disownership is 5.5 here or 4 here, and it's very specific to the affected limb. So the other limb feels completely normal and belonging to them. And the same, of course, in healthy, they feel no sense of disownership or estrangement. And just to say that this is not only like on a high level perception that they feel like their body does not belong to them. What we've done, and this is still work in progress, is that we used an adapted version of the implicit association test, where participants had to say as quickly as possible whether this is an amputated body or a complete body. And then they would also have words here, which would be either self-related or not self-related, and they would have to say whether it's self or not. And then by combining the two, you can say kind of how strong this association is. And here for the 2-color, this is just a test retest, which actually shows that also the results are quite consistent. But what you can see here, and I hope it's not too small, is this is the healthy controls. Positive values means that they associate the self more easily with a complete body. Negative is the opposite. So the healthy, as expected, self-attribute stronger with, or self-identify stronger with the complete body, while these are actually control group with an involuntary amputation, and they lie in between. So it's not very clear whether they, which is also interesting itself. So they identify kind of, I mean, they have been complete body before and then incomplete, and it's kind of in the middle. While for the BID, they self-identify stronger with this incomplete body. So then, of course, there's very different theories of what might be the underlying mechanisms of this BID. And one that has been especially attractive for people more from neuroscience is that BID might be a failure kind of to fully integrate this fully functional body into a kind of higher level representation of the body. And it has been termed, I mean, this is a theory actually that I think has been first proposed by Ramachandran and colleagues, and it has been termed xenomelia, to make it more like sound also like a neurological syndrome, so no longer like a psychological as it was perceived before. And the idea is that if this is the case, there should also be some sort of altered multisensory integration processes, or even unisensory ones. And there is actually a few studies who looked at that. It has been shown, for example, that there's altered temporal order judgment between tactile events that are on the affected versus non-affected body parts. So they often really have this clear border of where the body still belongs to them or when not belong to them anymore. And there's also reduced pain anticipation for the affected limb as compared to the unaffected limb. And actually, and this is also again very preliminary, we did in the study, in the lab, a study with 20 participants where we looked at pain thresholds, first of all. So people had to say whenever a tactile or a heat stimuli felt painful. And also we looked at placebo response. And it's interesting in this group of people or individuals that you can compare left and right leg because one is affected and one not. And that's exactly what we did. So we compared the leg where they desired an amputation versus, the desired leg, actually it's complicated, and the undesired leg. And what we could show, first of all, by this, sorry, a bit ugly graph here, is that generally for the undesired leg, the pain threshold is much higher, which means that they're less sensitive somehow, which I guess makes sense. But then for us, even more interesting is that this is a pre-measure before we put a placebo cream. So this cream was supposed to be a pain-reducing cream, but it was not. And what we could show is that this is what you would really expect. For the desired leg, the pain threshold went up. So that means they responded to the placebo, which is really something that has been shown many times, while this was not the case for the undesired one. which would suggest also that this modulation of expectancy did not work for the affected limb. Does that make sense?
Sorry, Bigna,
Yes.
Did you say what's the common clinical presentation when, what are the alleged causes of this BID? Did I miss it when you mentioned it, or?
What are they?
Why these people come with this? They appear like this, and it's not after an event or a thing.
No, yeah, no, it's a good. That's a good question, and I think as I work so much with them, yes, no. So generally, they come to clinicians because of this, because it's really stressful for them that basically they feel being in a different body than they are. However, it's not due to any brain damage or even like any clear sensory deficits or anything. So that makes it actually really interesting in a way, because it's really a normal functioning body, and also they generally don't have many comorbidities. I mean, depression, for example, is higher, but that seems more to be because of the condition. But they're fully aware of the, that, I mean, they're not psychotic or anything. So yeah, so that's an important point actually. Yeah, and then there's not really an official classification either. So that the first time now in the new ICD-11, this is mentioned as a clinical condition, but before it was really just that they came with this, yeah, the symptom.
It's present from quite young, I think. Has it been, yeah?
Yes.
From a young
age.
Yeah.
It's from, I mean, it has been labeled also, it has been linked kind of to personality disorders. And it's, exactly, also because it's a very early onset generally. It's also retrospectively assessed, but typically they say they have this desire since they are very young, like 6 or 7, almost since they remember. Yes. So, we also tested in these patients whether this multisensory, I mean, with the idea that if it's really this higher level representation that is somehow disturbed, we also looked at how they integrate different sensory inputs in the rubber hand illusion. It's not the rubber hand illusion, it's adapted to the rubber foot. And the fact is that the reason for that is that this disorder is much more common for feet than for hands. And actually also much more common for left feet than for right feet, or for the left foot than for the right foot. So what we did is really just the rubber hand illusion that we adapted to the rubber foot. And we could show that they are more susceptible for the affected limb than, so they have a stronger illusion for the affected limb as compared to the unaffected one. And this is actually interesting because very similar findings have been shown for somatoparaphrenia as well. So this suggests kind of that they have a weaker or a weakened representation of the body and can more easily include another body part. There have also been many studies on the neural correlates of BID. I mean, many, not very many, but I mean, since there's not too many people. But here I just give you a kind of overview over this. This is a very nice paper by my current postdoc, who did in the largest sample a study looking at different changes, morphological changes, and finding mainly this right superior lobe to be, or lobule to be involved, but also representation of sensory motor representation of the affected limb, as well as premotor cortex, which could underlie, I mean, it's all very hypothetical still somehow, but which could be this disturbed multisensory integration process. And we've also looked at white matter connectivity. And again, it's really this core areas in the supraparietal lobe that seem to be altered both in structure, but also in connections. So as I said, there's not so many participants, and or patients. And of course, that limits also kind of what we can say about it. So what we try to do is to see whether we can have some sort of similar phenomenological state in healthy participants using experimental settings. So very similar to the rubber hand illusion, but this time the idea really was that we would want to induce more specifically this sense of disownership by actually breaking the expected contingencies that you expect from your body. So if I move the hand, of course, I expect that I would get the synchronous, tactile, visual, and so on information. And the idea was to break that and see how this would affect the body perception. And what we did first is in a study with Oliver Canape, who was actually also together with us in Olaf's lab doing my PhD. We had people with this head-mounted display, infrared head-mounted display, so they could see their own hand through infrared. And then what we would do is touch them, so very similar to the rubber hand illusion, but then either it was presented synchronously or we added some delay. And more recently, we moved to a bit more ecological somehow setting, in which here you can see me with a head-mounted display again, but then on the head-mounted display, there is a video camera. So you can, basically what you do is just copying the reality. So they look around and they see exactly the same as they would see, but just through the headset. And then again, we touch them on the hand and introduce a delay of different steps. And what you could show, or what we could show in many studies now, is that this virtual hand, or if you ask them whether this hand feels like their own, this is very much reduced if it is the asynchronous condition. So it's basically kind of an inverse rubber hand illusion somehow, but it really targets more this, it really, people claimed like it really doesn't feel like my hand anymore. So it really, I think, goes further into this disownership, the idea of disownership or the experience of disownership. So the next slide is unfortunately really a busy slide, but this is, I will just walk you through, but this is kind of the type of experiment that we're doing with this setup that I described here. So we do different, we assess kind of body ownership in different ways. So one of them is that we just do this visual tactile simulation for a long time. So this is very much like the rubber hand illusion. And then we give them a questionnaire, a detailed questionnaire on what they felt. So very similar to the one you saw by Longo. The other way that we manipulate, and you don't have to look at all the different, at all the panels here, but is that we have many trials, very short trials, in which we touch them at different delay steps. And then they always have to answer whether the touch was synchronous or not, so first choice, and then afterwards, how much it felt like it was their own hand. And that way we get like many different trials, and we can really kind of psychometrically modulate how this sense of ownership or disownership is affected by the actual delay that we introduce. So this is just first the data of the questionnaire. So this, I don't know whether you can read it, it's super small on my screen. But the basic idea was that we did, as I showed for the rubber hand illusion for Longo, we did this principal component analysis, and we could identify 3 components. And one of them is linked to the disownership. Another one is linked to ownership. So again, these were kind of, I mean, we labeled them, of course, but it seems really that these are 2 different constructs, the ownership and the disownership. And the second component was linked to this deafference. And I will not talk about that much, but that's what a lot of people also spontaneously claimed, that it really felt like numb, which I think makes sense if you see the touch, but you don't feel it, or you don't feel it yet. Yes. Then we also looked at these components, how they are modulated by the asynchrony, and where you can, I mean, you can see all the components are very strongly modulated by synchrony. Disownership is higher in the asynchronous condition, as we would expect. Deafference is higher as well, and ownership or embodiment is lower. Then I think having now kind of this tool, which is of course not the perfect tool, and we are still elaborating for inducing similar states of disownership in healthy participant is then interesting again to look at underlying mechanisms. So one thing that we did in this first study that we did together with with Oli Canapé, was that we used TDCS, for example, over this area, the superior parietal lobe, which has been crucially involved in these BID patients. And we could show that, and this is very preliminary data, but still that it modulates this illusion. Or then in the same paper, what we could also show is that this sense of disownership is stronger for the left hand as compared to the right hand. And this is, again, very comparable to what we find in BID patients. What I said, that the left side is much more often affected as compared to the right side. So then we thought about that it can also be interesting kind of to test, and I will not show all of that because I think it gets quite boring for you guys, but that you can test, for example, different sensory inputs. No? So for example, we also had them moving instead of touching, and you can see where the braking visual motor cues would more or were quicker induce this sense of disownership as compared to visual tactile one, for example. And one thing that I would like to present, which is this paper that has been published this week actually, is that we were interested to look at self-touch. And self-touch in general is something very interesting in order to define and reshape kind of your body sensation. And there have been a lot of literature suggesting that self-touch, even in development, is very crucial in order to align the different inputs that you get from the various sensory cues, and to define and reshape your own body perception and body experience, because it's this situation where you get many different information about where your body is in space, for example. So what we did is that we did the exactly same paradigm, but this time instead of having someone else touching the real hand, we had them touching their own hand. And again, we had these very short trials and we had the long trial. So this is a very short one where they touch, and you can see this is the very delayed condition, and then they would have to say whether it was synchronous or not, and then they would have to say how much it felt like their hand. And you can also see here how we have them responding. So they do all with the head-mounted display, which is quite convenient for it. So you don't have to present any questionnaires afterwards and so on. No, it doesn't stop. So what we expected based on previous literature is that this self-touch would help to still feel it's your body, even despite the delay. And it has been shown, for example, also for the rubber hand illusion, that self-touch enhances the illusion, so that that it would increase kind of this ownership of the external body part. And actually, I mean, that's exactly what we found. So we had these three conditions: one, an external touch, one is self-touch, but you don't see the touching hand. I will not really talk about that, but I'm happy also to discuss it in the discussion if you're interested. And then the other one was the self-touch. And what you can see here plotted is the sense of body ownership and the delay that we introduced. It might seem weird for you that we had these very strange delays, but that's because we added the intrinsic delay of the system. So you can see that for the self-touch, it felt longer, like being, I mean, the decrease is kind of less steep. So suggesting that even with higher delay, it still felt like their own hand. And then if we look at this long questionnaire, so that it was exactly the same design that I explained before. So if you do the stroking for a longer time, and then we just compared sync asynchronous between self and other, you can see again that it's the disownership was highest when someone else was stroking, but and then it reduces, and the opposite pattern for the embodiment. So that suggests again that if you do self-touch, that it would feel more like or longer like your own hand. So this again is in line with findings from stroke patients. So here again, here it's now the neurological patients who feel like it's not their hand, but they also have typically like sensory deficits and so on. But it has been shown that there also it helps that if they do self-touch of the affected hand, that this leads to a decrease in this sense of disownership, which potentially, of course, would be a very interesting also therapeutic tool. So we were also interested, and this again is very fresh data that we haven't fully analyzed yet, to see how this changes in BID patients themselves. And again, we had to adapt, of course, our real hand illusion to the feet, but we did exactly the same thing, so they could see their own feet, the environment as it is, and then we introduced this delay. And what you can see here is quite interesting. So you can see that the affected limb has general lower ownership rating, and it decreases kind of faster than the unaffected one, which is what we expected. However, I mean, to me, even more surprising somehow is that they seem to experience almost full ownership for the affected limb in this setting, if we ask them that way, which is very different from the numbers I showed you in the beginning, where they feel like this strong disownership. And I don't have an explanation ready, but I still think it would be interesting to see whether this mediation kind of this virtual environment, whether that might somehow cause this effect, or whether it's just because we asked in a different way and we didn't ask about their own body, but about the in the virtual reality seen body. But I think potentially that's really an interesting finding. If we look at the delay detection, so this was this first choice between whether it was sync or not, we can see what we find in healthy participant, but even that is much less steep than generally. For the unaffected limb, that for both limbs, that it decreases with increasing delay, which makes sense. But here now you can see this clear difference between the affected and unaffected limb, suggesting that they have troubles in detecting delay, or it feels less synchronous for them on the affected limb in general. So it never really feels synchronous, which is interesting as well. But it feels like their own, but not synchronous. So this might suggest, again, some sort of altered multisensory integration mechanisms. So with this idea that maybe the different modality, or if you're in virtual reality, that this could kind of change the perception of their body per se, or even this multisensory integration, or the aspect of top-down and bottom-up weighting. We were also interested in general to see whether virtual reality could be a tool for these patients. And I think there's two ways that people discuss how you could deal with this disownership. So one of them would be trying to make them feel like their body belongs to them again, and this would be something with the self-touch, for example, and so on. However, that's not really what the patients want. They want to adapt the physical body to their identity somehow, which makes sense. But so what we looked at here in the lab, again with 20 participants, is that we had them embody in virtual reality a body that corresponded to their specific desired body. So we adapted the length and so on, so that they could really feel like exactly in the body that they feel like being. And we looked at EEG as well, which has not yet been analyzed. And again, this is very fresh data. But what we could show, and again, we compared it to healthy controls as well as to amputated people with an involuntary amputation. And what we could show is actually that they identify as much as the others with the full body, so there's no difference in there. So again, this is very similar to, I guess, even the rubber foot illusion. So they are able to embody a full virtual body. However, they feel much more ownership for this amputated body. And what's interesting here is that this had very strong effects on their mood. I mean, even when testing, they were super excited about it. Most of them also said they would use that at home. And we asked for the mood, how it changed, and really like the big part of all participants. These are number of participants. I think, can you still see my mouse? And then the ratings, this means it improved a lot, and this would be it worsened, but you can see that really they improved in general. And this is weeks after, so directly after the experiment, all of them were like, the mood really improved. So I think that's also a way to go, which is now not linked necessarily to the sense of disembodiment, but kind of linking the desired body and the visual cues that they get from their own physical body. And actually, this is a paper where that is was published very recently, where they had 2 case reports where they used augmented reality, so they could see their own body. But when they looked down at them, they could see it cut in a way that they wanted the amputation to have. And this first publication suggests very positive effects of that as well. So I think it's exactly 1 hour because it's 6:33 on my clock. So I will do that very briefly, conclusion and discussion. I hope I could convince you that the sense of the bodily self or the body is very plastic, and that we can both embody external body parts or like even full bodies, and we can also, using very similar methods, reduce ownership for the own body. And also that these processes seem not to be, I mean, they seem related, and it's also the case that in patients with disownership symptom, they show also increased ownership from often for like external body parts, but it does not seem to be the same process. And I think it's very interesting to disentangle the two. And then current studies are really biased to, I mean, current study on the sense of ownership are really biased into this direction of feeling another person's body or a fake body as the own, and much less research is done on the own body and trying to see how mismatch of the own multisensory might affect body perception. And I think that this kind of easy setup, experimental setups that we designed with this virtual reality, which is really open source, and I mean, it's quite easy to implement, might help to complement kind of findings that we have from these BID patients, for example, with multiple patient as well, with data from healthy participants. And I hope, of course, that better understanding this underlying mechanisms would at some point help to define kind of new therapeutic tools for these patients. So with that, I would like to thank, first of all, the Swiss National Science Foundation, who funded all of these projects, I think, and me for a long time. And then also my wonderful lab, who did I mean, all of this work, most of this work, the other collaborators who were involved in the work that I presented, and of course also you for your attention.
Thanks very much, and you can join me in physically, showing auditorily, clapping, or you can do it virtually, as I can see some other already. There's already one question by Liors Mikrod in the chat. Bigna, if you want to read it.
Wait, I don't see the chat right now.
I can read to you with my weird accent.
Ah,
no,
okay, now
with
I see. Okay, I see a lot of chats. So read it, Jude. I think you have the better.
At the end.
At the end, okay. Okay. Does everyone see this? Should I read? Methodologically, are there behavioral tasks on the sense of ownership or agency that can be conducted reliably online for healthy participants? This is a very interesting question that, of course, we're all asking ourselves. I guess also, Jane, we were talking about that a lot. I think for the sense of agency, it's a bit easier somehow, because you can now you could have like a mouse track and then tracking a mouse, and then you can show the visual feedback with different delays or something like that. Because I think it's a bit less bodily in a way, even if you're interested in the sense of bodily agency, but you can show an external stimuli. I think for ownership, I really think it's difficult. So what we're currently doing is that we look at altered ownership, like using this, like the filters that you can use on Snapchat, for example, that we try to alter somehow aspects of how you look and then look at that. And this can be done in an online way. But the problem really is that the body, I mean, online is difficult in general. You really need like sensory, like tactile cues and so on. So if you have ideas, happy if you let us know.
Super. There's another question in the chat, and also Jane has her hands up. So you go ahead, decide.
I don't know, Jane. I don't know who put the one in. Maybe it's yours. So go ahead.
Thanks, Bigna. Really fascinating talk. Yeah, I think it's really interesting how these new ownership illusions that you create, and like the one with Oliver Canopy, are showing a stronger sense of disownership than things like the rubber hand illusion, which everybody always used to claim did create disownership. It'd be really interesting to compare in the same participants the rubber hand illusion and do you call it the real hand illusion? I've forgotten what it's called now. Yeah, to see, to directly compare them, I suppose, with the same questions. And I wondered if you'd looked at any physiological measures, because I know there's been a real problem in trying to replicate the finding of Moseley, where they showed a reduction in skin temperature of the stroked hand during the rubber hand illusion. So there's been problems in replicating that finding, but perhaps because the sense of disownership isn't very strong in the rubber hand illusion. So I'd expect it would be stronger in the real hand illusion that you're creating. So I was just wondering if you were thinking of trying that out.
Yeah, I think it's an interesting question, and we did have it. We did measure skin response to threat, which is a very classical measure for the rubber hand illusion. We did not measure temperature, which would actually be interesting, because I think really this temperature you would expect to be much more linked to this sense of disownership than to ownership of a other body part. So I think that would be very interesting to do, while for the threat, we did not find any difference at all, which I think the interpretation, and I think it makes kind of sense, that it might not be strong enough to, like not react to threat anymore somehow in that case, because you have the first person perspective on your own body. So this was a sort of try to explain why we did not find this difference between sync and async in threat, which has been replicated quite a lot for not by our lab, but by other labs for the rubber hand illusion and similar. And then the other question was about directly comparing them. So I think this would be very interesting, and we've never done it. What we tried to do with students, but then didn't trust the data in the end, was that we had it in virtual reality, which would, I think, be a very nice way to really compare the two, to have like a virtual rubber hand illusion and then the real hand illusion, and see how this would be correlated. But yeah, I don't have results on that.
I have a question from the direct chat, and Brian is also raising his hand, and a few others. So I'll ask the question from the personal chat. As part of somatic passivity in schizophrenia, patients can have a feeling of a body part being directly moved by an external force. Could this in some way be to do with pathological loss of synchrony of inputs, or if that's the case, what sort of mechanisms do you think might explain this? It's a classic schizophrenia. Someone is moving my my body part.
Yes, I would expect to be similar mechanisms to be involved. No, some sort of mismatch in the prediction of your own movement and in the feedback that you get. So I would think it's linked also to this same mechanisms, but I don't know it. And of course, it would be very interesting to look, for example, I think at these thresholds as we look now, as compared to, for example, visual tactile thresholds as compared to visual motor thresholds, and to see how they would be altered in these specific patients. And again, if that happens, but that I don't know, if that's rather for one side specifically, I think it's always very interesting to have this within the same subject control of left or right hand, no? which makes it much easier somehow to compare, because these illusions, for those of you who tried it or who worked with it, they are very individually different. So some people experience them a lot and others less. So having
That's
this
good.
within control, I think, is extremely interesting also for the BID, for example.
Yeah. Brian, I think had a next question.
Yeah, in
Go for it.
the study you described at the end, if you have a person who feels that part of a limb does not belong to them, and then you somehow show them a body which really doesn't have that limb, and you reinforce that perception, and that somehow makes things better. But so it seems to me like you're reinforcing the problem that they have. Wouldn't a better approach be to try to convince them that that limb really does belong to them, that it's really there and that they should have it? I mean, it seems a bit strange as a treatment to reinforce the problem.
Yes, I mean, I think it's a very, very interesting point, and something also that I thought about a lot. And I think naively starting when I started, like 10 years ago with investigating this BID, I thought, of course, you need to know, like, make them feel the body as their own again, or like the body part as their own again. However, talking to these individuals, really, like they said, I mean, it's really this, that you try to change their identity rather than changing their physical body. So we initially also thought, like, you could stimulate, like use TMS and stimulate this higher representation area in order to kind of facilitate this reintegration of the body part, for example. However, they thought this would be much more invasive, changing their personality basically, than cutting off their leg. So I think it's a very difficult kind of ethical debate, and the way we approach it now is that we try kind of both. And of course, I mean, the patient has to agree anyway, no? So, but that we try to see to what extent we can make them feel more comfortable, at least with this leg that they feel like is not their own, but at the same time also explore ways that make them feel better, at least temporarily, because something that these people do a lot is so-called pretending. So they bind up their legs in order to feel a sort of relief. And the mechanisms that they use to get to this body state is often quite dangerous as well. Like if they bind up their legs for a long time, that really might hurt. So the idea, I guess, of this virtual reality is that you could have a non-invasive way to get to the same point somehow. But I'm fully aware, of course, of this, that no, it makes them feel better and it could increase even more the desire. So I think that's a very tricky kind of ethical debate. And I would never suggest to just give them the VR at home. No, it would have to be some sort of integrated therapy in general, I guess.
Thanks. Can I ask something else related to the question about the possibility of doing things online? Do you know how convincing the VR has to be? I mean, my impression is that even the best VR systems, the visual sense is a little bit blurry. It's not quite like seeing the real scene. You would never be convinced that that really is the scene. So you're obviously getting away with an approximation already. And do you think the cheapest possible VR system would still give okay effects and allow these things to be used more widely?
Yes, I mean, I think so, actually. I don't think visual resolution is extremely important, for example. I think what makes it difficult to kind of translate, at least as the experiment we're doing now, is rather that we would want some sort of motion capture, no? That you could move the body and it would show it synchronously. I mean, there are solutions for that as well, but I think it's not yet kind of as plug and play as we would wish it was, because even in the lab, this body tracking is quite complicated and often not like perfect. But if it's just like to present the virtual environment and not so much the virtual body, I think that would work to make them feel like being in a different place, no, with very low resolution devices.
Bigna, there was another private question in the chat which matches my notes, so I'll double ask it. There was a recent paper that sort of created quite a lot of stir, and you might remember from Twitter and also from reading the paper from
Sure.
From Sussex, sort of pushing the idea that the rubber hand illusion and the neurosynesthesia were at least explained away by hypnotisability sort of ideas, or if you want, sort of the compliance or the meeting the expectancy from to the researcher. The idea that effectively people are easily, people who are followers, and they're more likely basically feel that, and then in the paper they're about more nuanced, but in Twitter they were a bit more
a bit less
Twitter like saying, hey, the rubber hand illusion is an illusion. It really doesn't really happen. Doesn't really it's not a real effect and all of that. I'm fairly convinced by the paper itself that is real, and by a lot of results that you have shown us that there's a lot of modulations one can do. But what's your take on that big sort of discussion from these last couple of months?
Yes, I mean, I think the Twitter ones I kind of ignored. But,
sure, but the
paper one I think is interesting, and I don't know. I don't have a very strong opinion. I mean, I think there's some problems also with the paper, like methodological ones. But in general, I think the basic idea is very interesting. No, that and this is what I said before. There's like this big individual differences, for example, and I guess a part of that is really could be explained by something like suggestibility, which is itself super interesting. No, I think to me it's really like it doesn't make it less interesting to me whether they experience it because they're more susceptible, or what's the word. So I don't really see the problem that much, I guess, as many others. So to me, it makes sense, and it makes it as much interesting as before because the people experience that, no? And I think what they say is kind of its phenomenological control, which is itself super interesting, no? So yeah, I don't know. I don't have a very strong kind of opinion. I think it's interesting. I think the rubber hand illusion is really in a way that people experience it, and I don't know, not everyone, but if you experienced it, I mean, it's really like something very interesting. Of course, they know it's an illusion, no, and this is different to other illusions, maybe. No, very often the comparison is made between kind of these visual illusions, where it's really like everyone perceives it, and it's really hard to believe, apart from if you really take it apart. And that's not the case for the rubber hand. No one thinks it's actually their hand. It just feels like it.
Yeah, no, I agree, and also had this more nuanced read, and I hope that also makes.
And then in addition, I mean, it's also like all these measures that I agree. Also, some of them, as Jane said, no, are not really replicated. But yeah, if with this phenomenological control you could change even like the immune system, no, like this would be super interesting. So yeah, I really don't see the problem that much, I think.
That's cool. And there was also about a commentary on the sensory inattention and how that sort of relates between auditory inattention or visual inattention type of more defined experiments and this one. What's the role of attention in this respect when we're doing these illusions? Can we do like an attentional, like neglect, easily in this sensory? So could we try to do some sort of neglect, aspect for these patients, for example, to make them feel, so pay less attention to that, and that will make them feel better?
I don't know, interesting idea. I never really thought about it. So to train them kind of to focus more on the healthy side, for example, something like that. I don't know. I really don't know. I mean, I think it's if you talk to people with BID, I mean, it's really like a lot of their attention, of course, is like on this affected side, because it's disturbing and so on. So it might be something to consider. I don't know. I never really thought about it. In general, I think attention is also something interesting in these illusions, to see whether, for example, even with this real hand illusion, if they attend to the vision more than to the tactile, would that kind of change the thresholds? No, because the vision still is more the virtual part of your body, where the touch stays kind of your own, is really on your own body. So I think that's something that I would really like to do, to change attention and see how this affects this psychometric curve somehow. But yeah, as a therapeutic tool, I don't know.
Yeah, I have to think about it. It's really fascinating. I'm gonna double check if I got more private messages. I think I haven't. Helge said bye, see you later. If there's any, Jane has another question. I see the hand. Go ahead, Jane.
I think you said in an earlier slide that if you compare, there was a study that compared the changes induced by the rubber hand illusion and those induced and those that are present in somatoparaphrenia, and that they weren't quite the same. Was that right?
Yeah.
To sort of argue the point that the rubber hand illusion isn't really inducing quite the same thing as these clinical conditions. But that made me think about the paper that you published with Silvio Ionta, where you induced the full body illusion in an MRI scanner and showed modulation of the temporoparietal junction, which is, of course, the same area that's affected and is thought to cause out-of-body experiences. So do you think that perhaps the full body illusion is more effective in producing something like an OBE than the rubber hand illusion is in producing something like somatoparaphrenia? Yeah,
I think it's two different aspects maybe. So I think the paper that I cited, so that it's both in patients. Now it's patients who just feel like their hand is not their own, as compared to patients who feel like their hand is not their own, but if you put in front a rubber hand, they would feel that this is their hand as well.
Okay.
So this is kind of the difference between the two. What I would argue that if you look at the neurocorrelates between the rubber hand illusion and, for example, the BID, that there I would not expect this strong overlap, because it doesn't really mimic, it's not really the same thing. No, one is more on the embodiment of something else as compared to disembodiment of your own body. For the paper, the one on out-of-body experience, I think there actually it mimics quite nicely, even of course not half as strongly as a real out-of-body experience. It manipulates kind of the same aspects of the body itself.
Mm-hmm.
Yeah, does that answer the question?
Yeah, okay.
Super. We're almost on time, which is really good. Any
Very
last,
Swiss.
Yeah, I am. I'm part Swiss. This part I recognize as my own. So join me again in thanking Bigna for this great talk. And then we'll see each other virtually or physically at one point in life, hopefully. Don't hesitate in sending long emails with your own sort of weird physical sort of sensation to Bigna. She's pretty used to it. But also, scientific questions or or comments. Don't hold back. the Zangwill speakers expect you to, to get drowned in commentaries and questions after the talk. And yeah, have a good Friday, everyone.
Bye-bye. Thank you.
Ciao, ciao. Thanks again. And we have
stop share. Sorry.
We have Helge sending us another Zoom link for the beer.
Yeah, but I first have to bike home. Huh?
Yeah. You go bike. I also have to do stuff. Kids are coming.
But I will look in. I mean, I will briefly join for sure.
Yeah.
Try to join. But they didn't get back to us, no? About the symposium or not? And
oh,
so
they
on,
just
so.
sent an email. They just
they did. Okay.
Yeah, saying they're gonna, talk to you and Helge straight.
Okay.
Not with us, that we're off the picture.
Yeah.
Well, we can comment later. I'll see you in whenever you're home.
Yeah. Bye. Ciao. Thank you.
Ciao.